everyone, Dr. Kimball here. We're going to go into part 2 of our 3-part series, Rules of Engagement for a Consultation with a Spine Surgeon. This is part 2. This is really about what to expect during the visit. What are your responsibilities when you sit down with a spine surgeon like myself? So I like my patients to come to the visit as educated as possible, but also to be open to understanding what's really going on. One of the challenges in medicine is that we have Dr. Google out there, and there's lots of questions, lots of things that you can learn that might not necessarily relate to what your problem is. So be ready to answer questions, be ready to rehearse the history of your spine condition, what you've done to treat it, and what has helped and what hasn't helped. Trying to be clear with timelines and with amount of improvement can really help the surgeon. So coming prepared with that information is really critical. Number 2, if you're like me, you want to know that your spine surgeon is going to treat you like he or she would one of their family members. What else can you ask for, right? My patients ask me that question at the end of every visit. It might be reasonable for you to start the visit with that expectation and just reiterate to the surgeon that that's what you're expecting and hoping to get from them. Okay, I know, most spine surgeons know that nobody comes to us begging for surgery. Nobody wants their back or their neck to be cut on. On the other hand, some people actually do, and some of those people that want to have surgery might not actually need surgery. So we're actually not just battling to find patients to operate on, we're actually trying to find the right patients to do surgery on. So give your spine surgeon the benefit of the doubt that he or she is there to help you feel better and not operate on you just because nothing else has worked. That is not an indication for surgery. There has to be a problem that relates and correlates to your pain, and that is something that we think will provide a reliable, justifiable reason for surgery, given that there are risks to surgery. Okay? So when you're engaging with your surgeon, you need to keep those things in mind. I want you to always not suspiciously ask your surgeon, why are they doing something? But I want you to ask the surgeon, are there any other ways to treat my condition? Some surgeons, maybe older school surgeons that have only been doing surgery one way, will only come with one answer. I won't get too into that today, but it's more of a shotgun approach to all spine problems, and they treat them all the same. Personally, I have a bias. I'm telling that to you right now. My bias is I want to find your particular problem and only fix that problem, because I know from experience that if we try to fix everything, sometimes we can cause more problems along the way. Spine surgery is complicated. There's good and bad stories about it. Most of those bad stories are patients that have had more surgery than they needed for an indication that was less than certain. So always question your surgeon's approach. Ask him to justify why he thinks this is the best approach, why he would want this surgery for himself if he had your condition. Understand that the surgeon is usually offering surgery that is elective. On rare occasion is the surgery life-saving or limb-saving or function-saving. So you need to recognize that at the end of the day, it is really your choice. You're the patient, you're in charge of your own health care, and you need to be making that decision with the surgeon's help. It's not them against you, it's you working together with them. You need to either come to the conclusion that, hey, I trust this person to fix my back or my neck, or maybe I need to find someone else. And if you do feel like they're not the right person, you might ask them for a reference for a second opinion. You might also be coming to them with a second opinion, but I think it's reasonable for you to share another opinion. Well, if you're saying I need a fusion, why did Dr. So-and-so say I could do it with this surgery instead, and that's not a fusion? Or don't you operate using disc replacement therapy? Is that a possible way to fix this? Coming with those questions is really your prerogative, okay? I hope this has been helpful. Take this to heart. Do your research before you show up with your surgeon. Ask lots of questions, expect the best, but please don't just take whatever they say as the only way to do it, because the amazing thing about spine surgery is there are literally 3 to 4 ways, maybe even more, to approach a particular problem. You can go to 10 surgeons, you get 10 different opinions. So my goal as a spine surgeon is minimal disruption to motion, minimal disruption to normal tissue, and trying to avoid you having to come back for another surgery. And I'll leave it at that. Have a great day.